Hello everyone, and welcome to our first ever virtual groundbreaking. I want to thank all of those who are watching this event and all of those who have been responsible for this event coming together. But the main point that I want to make as we get started is that the greater community of Sandusky and Erie County and Perkins and our surrounding areas is truly blessed with what I believe is the finest independent health system in America today. And what I want to tell you now is that we deserve this project. If the last 5 months is any indication of how a community health system steps up in the face of adversity, it will tell you that we need to continue the tradition of excellence in our health system for years and years to come. Right now, I have nurses and physicians on the front line in our emergency room taking care of each and every patient that comes their way, knowing that patient may have a coronavirus diagnosis. I have nurses on our COVID unit in full protective gear 24/7 taking care of patients with COVID diagnoses. I have housekeepers and dietitians and ancillary service individuals who are in and out of rooms, literally putting their own health at risk to care for our community. And what I want to say is that it's due time that our outpatient primary care facilities match the high quality of the physicians and staff and health system that we have here in our community. With that, I am Jeremy Normington. I'm the president and CEO of Firelands. I simply couldn't be more excited about this project. My experience tells me that strong and vital primary care is essential to the health of not only a community, but a health system as well. When I interviewed for the CEO position here at Firelands, I expressed this sentiment to the board, and the board agreed. This project is so important as we seek to improve the health care of our communities. It will help us recruit and retain top talent. It will show our community that we are dedicated to this community through reinvestment. Today we are here to celebrate the fruit of our collective planning labors and embark on a journey that will benefit all of the individuals in the communities that we serve. Today you will hear from our board chair, Jim Miller, who will speak about what makes for strong communities. You will hear from our very talented internist, Dr. Zwarker, who will speak to the physician perspective and why this facility is so important. And finally, you will hear from one of our outstanding medical group leaders, Katherine Smith, who will discuss the vision for comprehensive primary care that will be delivered in the Sandusky Healthcare Center. So without further ado, I'd like to introduce the Firelands Board Chair, Jim Miller.
Thank you, Jeremy. Most of you know me as a teller of history stories, but today I'm going to weave a story about the present and the future. In my many years of looking at banking opportunities throughout Ohio, there's a common thread in defining a robust community. The most successful communities have strong local leadership, strong and competitive school systems, a history of philanthropy, good public services, a community bank, an active library, and an independent community hospital. Missing any of these elements puts a community at a disadvantage. Our vision at Firelands Regional Medical Center is clear. The ultimate goal of any decision we make or any project we undertake is that 20 years from today, we continue to have an independent community hospital in Greater Erie County area. To achieve that goal, we must be financially strong. We must provide first-class quality care. And we must provide great customer service. Now someone is going to whisper to me that they're patients, not customers. Yes, when they hit the door and they're under our care, they are patients. But with the choices in healthcare today, we must remember patients are customers. We are financially strong. Strong leadership and sound financial decisions and planning over the last 40 years has placed Firelands in an enviable financial position. We do have first-class quality care. A lot of time and effort goes into training, education, investment in state-of-the-art equipment, but most of all, the efforts of our 2,300 people who make up our dedicated staff. Now I'm going to digress a little on 2,300 people. Beyond providing first-class quality care, we have 2,300 people who live here, shop here, send their kids to school here, pay taxes here, and support the community. You would not see that if we were not a community-based hospital. We've always worked to provide great customer service, but in this busy world, which seems to get busier every day, customers/patients look for and demand convenience as well. And this is why we're here today. We are breaking ground on the Firelands Sandusky Healthcare Center, which will meet the needs of primary care with one stop. A patient can visit their physician, obtain a lab draw, have an x-ray, all in one convenient location. This investment is part of our effort to make certain our community will have an independent community hospital far into the future. Thank you all for coming today.
Thank you, Jim. Dr. Zwarker?
Hello everyone, my name is Dr. Niharika Zwarker. I am an internist with Firelands and I've been with Firelands for 8 years now. I'm very excited to be a part of the team at the new Sandusky Healthcare Center. I believe primary care should be convenient, accessible, and should be focused on patients. And I think the new healthcare center will definitely give an opportunity to grow the primary care in this area and also increase the access to primary care services for residents in Sandusky and the surrounding area. It will also help to provide a more team-based comprehensive care that has shown to improve patient outcomes and also improve the quality of life for our patients. It will also provide a good balance of physician subspecialties and ancillary services so that we can continue to serve and support our local communities. Thank you.
Thank you, Dr. Zwarker. Dr. Zwarker and Dr. Conley have been integral in our planning processes, and we thank them and all the physicians who have taken part in the planning. Now, Katherine Smith.
Good afternoon. I'm Katherine Smith. I'm the Director of Quality with Firelands Physician Group. I'm very honored to represent our physician practice team today, and actually more excited to give you a glimpse into what the new Sandusky Healthcare Center will do for our primary care service. Primary care is widely acknowledged to help people live longer, feel better, and avoid serious health complications. Health systems with an orientation towards primary care similarly have improved outcomes, fewer disparities, and improved cost. However, the delivery of high-quality primary care does not come without considerable effort, which I'm sure our clinical teams can say. Primary care has experienced significant shifts in how it is delivered and financed, and Firelands has been dedicated to really these emerging models to deliver that comprehensive care. You probably wonder what we're talking about. Well, these models, often referred to as a medical home model, require increased access, coordination, and a team-based philosophy. Successfully achieving this vision requires the right infrastructure, a capable, engaged care team, and of course, loyal patients. This progress does not happen overnight and has been years in the making for our team. So now, given the wonderful opportunity to create a new center, we asked ourselves, what will we gain from this new space that we don't currently have today? And what will this center do to support this model and propel us into the future? Well, the answer is quite simple. Our physical environment must promote teamwork and communication. While traditional design is often siloed, we're striving for integration here. This improves the morale of our caregivers, the reliability of our teams, and of course the safety and quality of patient care. Communication and teamwork is also one of the largest drivers of patient satisfaction and loyalty. So you will see in the design of the new center, it's crafted around the way our patients will experience it, just as much so in the way that our healthcare providers will deliver it. It is integrated, purposeful, and therapeutic. This facility is also symbolic of an important partnership between the physician group and the medical center. We are incorporating multidisciplinary services across the organization with the patient and provider needs in mind. This systematic approach will be momentous for Firelands, the community, and of course, most importantly, our loyal patients. We look forward to caring for you and your family there. And next up, Jeremy.
Some of our guiding principles in this project were that, as Katherine described, we needed this facility to be conducive to delivering primary care services. And so the setup, the team-based approach, the flow of the patient, all is uniquely designed in order to do just that. This week, I saw a report from our medical group leadership that our satisfaction for the patients is at the 98th percentile in terms of ranking. That means if you line up 100 medical groups across the nation, we're in the top 3% of those medical groups. And this facility will only enhance that. The other thing that we really wanted to do with this project is, those of you who know this space, it was an empty Drug Mart building that had sat vacant for some time. So the thought of beautifying this corner, which sits right smack dab on the border of Perkins and Sandusky, that adjoins to nice development through Kroger's grocery store, was so important. And one of our principles was that when folks drive by this building, they look at that building and they're proud of their community. That they're going to look at this building and say, I want to know more about this building. When they come into our building, they want to sense that we care about primary care, that we care about them, that we care about our community, and really offering a community health-based approach to primary care. To my right and my left are two exterior photos, but to get into the interior just a little bit and some extra stats. So the total investment that we're planning on putting into this project is about $25 million. We are excited that we are going to be able to use local workers, local businesses. That's always been a point of emphasis from our board and continues to be so with this project. The total square footage is going to be about 45,000 square feet over 2 floors. As discussed earlier, the services include family medicine, internal medicine, pediatrics, lab, and imaging. The new clinic design eliminates the traditional office workflow and adds to care coordination in the overall patient and provider experience. Upon opening, this building will house more than 10 providers with capacity to house up to 20 providers. We have future shelved space on the first floor for additional expansion in the future. And we also have built in a community gathering space to where the community will feel welcome and able to participate in this beautiful building. I'd be remiss if I didn't express our sincere thanks to Janata and Herner for their construction prowess and partnership in this project, as well as Prospectus, our architectural partner, as well as Carol Wolf. Carol's touch on the aesthetics and overall project is just huge for us, and so I thank you personally, Carol, for that. As you look to my right, I'll kind of walk you through the floor plan as we wrap up. On the left side of this board, you will see future shelved space in the orange. We have our imaging space primarily in the top portion of the poster board. As you work your way through the first floor, the purple space is what our community space will be, so that's right here. There's going to be a grand staircase that leads from the first floor open atrium to the second floor, where the majority of our physician offices will be. And down on the first floor as well, we currently have our lab offerings being located there for convenience for patients to get in and out quickly for lab services, and additional shelf space. As we move to the second floor, you will see physician spaces, workspaces that are developed in the pod and the team-based format throughout the second floor, with another nice area for waiting and open atrium. To the top left, you'll see a wonderful conference and meeting room, as well as a small open-air patio for folks to enjoy and really to take a break from their workday and get a little fresh air. With that, again, I want to thank you for attending this virtual groundbreaking. I want to just stress that it is due time that the quality of our outpatient primary care facilities match the quality of our employees and providers that we have here at Firelands. Thank you, and enjoy the rest of your day.